loved it. I'm like, shit. I was so mad. Did we do good? Besides the fact that I'm a dork.
Everybody's a dork.
Come on, cat.
There we go.
Hi, everybody.
Hey.
Alright.
Hi. So tonight we are going to talk about the importance of skincare in the elderly and the physically disabled. How would you feel if your grandmother or grandfather or other disabled relative developed a bed sore due to improper skincare? I've been an LPN for about 12 years, and in those 12 years, I have worked in wound care. In this presentation, I want you to learn the do's and don'ts of skincare, of how to take care of people who have impaired mobility. Now, let's start to talk about what happens to our skin. Our aging skin, as illustrated in the National Institute of Aging on Aging, we start off with dry and itchy skin. This is caused by lack of water, too much time in the sun, and stress. So the more stress we have, the harder it is on our skin. We look at some of our aging people and we can tell they've just lived a hard life. And due to that, their skin is thinner, so it's going to be easier to break down. There's also comes from disease processes. People who have diseases such as diabetes and kidney disease do not have the adequate blood flow to their extremities, to their feet, to their fingers, to their coccyx. So the blood's not circulating, so it's easier when their mobility is impaired to develop bed sores. So we have to keep ourselves healthy. We need to limit our sun and use sunscreen when we're outside. Drink lots of water. We need to drink at least half of our body weight in ounces of water a day. And we need to moisturize. Just because we can't tell our skin's dry doesn't mean it's not dry. So we need to apply moisturizer daily to our skin. Now that we know what happens to our skin, let's talk about our mobility when our mobility is compromised. Now, I want to talk about our risk factors for breaking down. And in this, I'm going to use from the EHS nursing care plans. So when they look at how your skin breaks down, they use something called a Braden scale, which it gives you the risk factors of how your skin breaks down, and it labels it 1 to 5. And the higher your number is, the more at risk you are for skin breakdown. So first it looks like redness and irritation. Are they at risk for moisture to their skin? Are they incontinent? Do they sit in areas, do they sit for long periods of time without movement? So if they don't have any breakdown, what is the potential risk? So if you sit in a hospital bed for 6 to 8 hours a day and nobody comes in and turns you, your risk is going to be higher. You could develop a pressure ulcer within 2 hours. And most people don't even realize that when they're in the hospital and they think they're being taken care of. These can happen very quickly.
So if you sit on the couch for 2 hours, you can get a pressure ulcer?
Yes, if you sit on the couch for 2 hours, you could develop a pressure ulcer if you have other risk factors. So we look at mobility, friction. So friction is when they slide. So if you're constantly sliding around, you're developing friction. Also, it looks at incontinence. Your nutrition. Are you healthy? Do you get enough protein? Do you get enough water? Your activity level. And your sensory perception. Can you tell when that place on your bottom is getting sore? You know, most of the time we tell we're getting red or we're getting sore, we're adjusting. But people that have the sensory perception, they can't tell. So they just sit there. And it's a lot of times with your people with diabetes that have neuropathy problems and they can't feel. Or as you age, your nerve endings die. So then you're just sitting there and not knowing that you need to move. So now that we know what causes the pressure ulcers, let's talk about the stages of the pressure ulcers. So in my screen here, we have the 6 stages of pressure ulcers. First one is a stage 1. That's just redness. So as ladies know, when you cross your legs for too long and you have that redness, that's what actually a stage 1 looks like. But the way that we tell the difference is if you press on your skin and the color fades and then comes back, you don't have a pressure ulcer. But if you touch on the skin and it doesn't, then you have a stage 1 pressure ulcer. And in this situation, we work on turning and positioning and putting a barrier cream to help protect the skin from friction and moisture. Then we move on to our stage 2. This is when you actually have an opening. So it's just the top layer of skin is gone. So it might look like just somebody sheared your skin. Remember when you used to take the razors and rub your skin and you would rub off that top layer of skin? That's basically what we have when we have a stage 2. A lot of treatments they do are the same as they do for stage 1. So they'll put like a thick cream barrier on those, kind of like you'd put on a baby's bottom, the thick cream, to help protect those, because you don't want to give them too much protection with like a bandage, because then you're just going to hold in some of that moisture. And then we have our stage 3. The stage 3, you see, that's going through not just your epidermis, but just going down to the next layer of skin. So now you're starting to develop an actual wound into your skin. This is when we're going to start seeing different treatments used on these. We're going to put bandages on these. We're going to use things to clean them up. Then as you get into your stage 4, you've went down into the muscle. Possibly could even see bone at this point. These are one of the worst stages of bed sores that a person can possibly get. They are packing with stuff. They might even have a wound vac on these. But then we have ones that we can't stage. We have an unstageable, which these are going to look like a bruise on top of the skin, like a deep purple bruise. And the reason they call those unstageable is because when the skin busts open, they don't know what's going to be under that skin. If it busts open, it could be a huge crater. And then lastly, we have the deep tissue, which you can see is black. So it's just rotting away underneath the skin. So in each one of these, the last 2, we're just going to try to protect the skin and keep it from breaking open. That way it heals, because as soon as we break open the skin, we're introducing infection into the skin. So now let's review what we've learned. We've talked about what happens when our skin as we age. We've identified the issues and how we treat these ulcers as they arise. We know what we need to do and we don't need to do to take care of our skin as we get old. So I hope you look at the mobility impaired differently when you see your grandparents, your parents, and they're not moving around as well as they should, making sure they're adjusting their position, because you don't want to have to be the one taking care of their bed sores, and you don't want to have them have the pain of having those bed sores. So, let's love the skin that we're in and enjoy what we have of it.